Hello and welcome. Let's talk about obstetrics and gynecologic instruments. So, let's talk about Leep Loop electrode. Now, this is a picture showing Leep Loop electrode. The another name of this instrument is loop and it falls under accessory category. The procedure is often called a hot cone biopsy and the most loops have an insulated shaft and a crossbar to prevent accidental thermal injury with the stainless steel or tungsten wire of the loop that is approximately 0.2 millimeter thick. Now, use. It is used for removing abnormal cervical cells electrosurgically for further pathological examination. The size and shape of the loop will be determined by the amount of the cervical dysplasia and surgeon preference. Let's talk about Heaney uterine biopsy curette. This is a picture showing Heaney uterine biopsy curette. It is a cutting and dissecting type of instrument. The identifying point is that a flattened handle that extends to a sharp and serrated loop tip is seen in this instrument. Use. It is used for obtaining uterine scrapings. Precaution. The serrations are sharp and can easily compromise the integrity of your gloves and skin and those of the surgeon. And of the let's talk about O'Sullivan O'Connor retractor. This is a picture showing O'Sullivan O'Connor retractor. The other name of this instrument is Iris retractor, O'Sullivan retractor or O'Connor retractor. It is a retracting and exposing type of instrument. Now, identifying points. A ring frame self-retaining retractor with attached lateral blades and interchangeable upper and lower blades. Use. It is used for retraction of the abdominal wall during open abdominal and pelvic procedures. Each individual piece of the retractor is included separately as a part of the count. End of the talk. Let's talk about Jacob's Vulsellum. This is a picture showing Jacob's Vulsellum. The other name of this instrument is Vulsellum, Jacob's Uterine Forceps and Jacob's Tenaculum. The category is grasping and holding type. Now, identifying points. This may be curved or straight heavy forceps with a flat square tip. Each inner jaw contains two heavy sharp teeth at the outer edge that interlock over each other when compressed. The horizontal serrations extend from the teeth to approximately 1/4 of the way down the inner jaw. Use. It is used for grasping the entire lip of the cervix for manipulation. The sharp teeth penetrate the fibrous tissue for greater control and it is commonly used during the vaginal procedures such as D&C or vaginal hysterectomy. Now, because of the penetration of the tissue after removal of the forceps, the site should be accessed for the bleeding. Hemostasis can be achieved with silver nitrate sticks, cautery or Monsil solution. Now, precaution. The care should be taken when handling this instrument because the sharp teeth can easily puncture gloves and or skin. End of the. Let's talk about Mayo uterine scissors. This is a picture showing different types of Mayo uterine scissors. The other name of this instrument is uterine scissors. It is a cutting and dissecting type of instrument. The identifying point of this instrument is that the long heavy scissors with curved or straight blades, and the straight blades are usually used for cutting suture and the curved blades are used for cutting tissues. Uses. It is used for cutting the heavy uterine ligaments and vessels during a total abdominal hysterectomy. End of the. Let's talk about Thomas Gaylor uterine biopsy forceps. This is a picture showing Thomas Gaylor uterine biopsy forceps. The other name of this instrument is Gaylor punch. It is a cutting and dissecting type of instrument. The identifying point of this instrument is a ringed instrument with a curved cup tip. The cup tips are sharp and as they are closed, they bite into tissues. Use. It is used for taking small bites of uterine tissues for examination. Let's talk about long angled number 3 knife handle or also known as cold cone knife. This is a picture showing long angled number 3 knife handle. The other name of this instrument is cold cone knife. It is used for cutting and dissecting. A long number 3 handle that is angled at the blade end is the identifying point of this instrument. Use. It is used for removing abnormal cervical tissues during a cold conization of the cervix. It is generally for a conization procedure and the handle is loaded with a number 11 blade. Let's talk about hysteroscope scissors. This is a picture showing hysteroscope scissors. The other name of this instrument is hysteroscopic scissors. The category is cutting and dissecting type. Now, identifying points of this instrument. These scissors have right-angled finger rings at the proximal end that lead to a long flexible wire that turns into straight scissor blades on the distal end. These are the very small and will fit through the working channel on the hysteroscope. Use. It is used for accessing tissues and taking biopsies from the internal uterus through the hysteroscope. These are the delicate and should be handled with care. The wire portion should not be kinked and the heavy items should never be placed on the top of them. End of the topic. Let's talk about hysteroscope biopsy forceps. This is a picture showing hysteroscope biopsy forceps. Now, the other name of this instrument is biopsy forceps. It is a cutting and dissecting type of instrument. Now, identifying points. These forceps have right-angled finger rings at the proximal end that lead to a long flexible wire that turns into rounded, sharp cup forceps on the distal end. These are very small and will fit through the working channel on the hysteroscope. Now, use. It is used for accessing tissues and taking biopsies from the internal uterus through the hysteroscope. These are the delicate and should be handled with care. The wire portion should not be kinked and heavy items should never be placed on the top of them. End of the. Let's talk about Schroeder Tenaculum. This is a picture showing Schroeder Tenaculum. The other names is single tooth tenaculum and brown tenaculum. It is a grasping and holding type of instrument. The identifying point of this instrument is that it has a smooth round jaws that extend to the sharp inward curved prongs. Now, use. It is used for grasping the anterior lip of the cervix for manipulation. The sharp prongs on each jaw penetrate the fibrous tissue for greater control. It is commonly used during the vaginal procedures such as DNC, vaginal hysterectomy or abdominal hysterectomy. Because of the penetration of the tissue after removal of the forceps, the site should be assessed for bleeding. Hemostasis can be achieved with silver nitrate sticks, cautery or Monsell solution. Care should be taken when handling the instrument because the sharp prongs can easily puncture gloves under skin. End of the topic. Let's talk about ovard weighted vaginal speculum. This is a picture showing ovard weighted vaginal speculum. Other names: weighted speculum. This is a retracting and exposing type of instrument. Identifying points: a self-retaining retractor with angled concave blades that extend to a widening oblong lip. From this lip there is a concave channel that leads to the bottom. At approximately 2/3 of the way down, the channel is the round weighted ball. Now, use. It is used for the retraction of the posterior vaginal wall. The blade is placed into the vaginal vault and the weight of the speculum allows it to hang in place. The average weight of this retractor is 2.5 pounds. A sterile globe may be placed over the bottom of the retractor to catch any fluid. End of the topic. Let's talk about Allis Adair forceps. This is a picture showing Allis Adair forceps. Now, other names: Big Allis forceps. It is a grasping and holding type of instrument. Identifying points: wide heavy tip with multiple interlocking fine teeth at the tip that reduces injury to the tissues. The jaws are much wider and heavier than regular Allis forceps. Use. It is used for lifting, holding and retracting slippery dense tissue that is being removed. In obstetric and gynecology procedures, it is commonly used to grasp vaginal tissue during an anterior and posterior repair. We will often need multiple Allis Adair forceps to grasp the excess tissue in anterior and posterior repair. End of the topic. Let's talk about Hulka Tenaculum. This is a picture showing Hulka Tenaculum. The other name, Uterine manipulator. It is a grasping and holding type of instrument. Now, identifying points. One of the jaws has a long ball tip probe extending to heavy horizontal serrations. The other side is shorter and has smooth round jaws that extend to a sharp inward curved prong. The heavy serrations and the curved prong interlock when compressed. Use. It is used to manipulate the uterus and thereby facilitate visualization of and access to pelvic structures during laparoscopic procedures. The probe tip is inserted into the cervical OS and the sharp prong penetrates the anterior cervical lip. Caution. Care should be taken when handling this instrument because of the sharp prong that can easily puncture gloves and skin. And let's talk about Eastman retractor. This is a picture showing Eastman retractor. Now, the other name of this instrument is lateral retractor. It is a retracting and exposing type of instrument. Identifying points. It has a hook and handle that extends to a widened lateral right angled blade that is slightly concave with a downward bent crescent shaped lip. Now use. It is used for retracting the anterior vaginal wall. The retractor is placed in the palm of the hand with the hook up and over the top of the hand for easier holding. End of the topic. Let's talk about Simpson Obstetrical Forceps. This is a picture showing Simpson Obstetrical Forceps. The other name of this instrument may be tongs or forceps. It is a grasping and holding type of instrument. Now, identifying points. Two large curved teardrop shaped blades that extend into the two shafts that interlock at the handle. The interlocking handle is not fixed and therefore the two sides can be completely separated for ease in placement. Now use. It is used for facilitating fetal descent and delivery when the fetus is lodged in the birth canal. The blades are placed properly around the fetal head and pulling the handle will aid in fetal descent. And let's talk about curved Ochsner forceps. This is a picture showing curved Ochsner's forceps. The other name is curved Ochsner forceps. It is a grasping and holding type of instrument. Now, identifying points. The curved inner jaws have transverse serrations that run the length of the jaws. At the tip of the jaws are three large interlinking teeth. This instrument is available with both straight and curved jaws. Now, use. It is used for grasping tough, fibrous and slippery tissues. Caution. The care should be taken when handling this instrument because the sharp teeth can easily puncture gloves and skin. End of the. Let's talk about Overstreet endometrial polyp forceps. This is a picture showing Overstreet endometrial polyp forceps. The other name of this instrument is polyp forceps. It is a grasping and holding type of instrument. Now identifying points. Curved or straight forceps with two fenestrated oval cupped tips is seen. Now use. It is used for the removal of the endometrial polyps and other intrauterine tissues. End of the topic. Let's talk about Simpson Obstetrical Forceps. This is a picture showing Simpson Obstetrical Forceps. The other name of this instrument may be tongs or forceps. It is a grasping and holding type of instrument. Now, identifying points. Two large curved teardrop shaped blades that extend into the two shafts that interlock at the handle. The interlocking handle is not fixed and therefore the two sides can be completely separated for ease in placement. Now use. It is used for facilitating fetal descent and delivery when the fetus is lodged in the birth canal. The blades are placed properly around the fetal head and pulling the handle will aid in fetal descent. End of the topic. Let's talk about baby Deaver retractor. This is a picture showing baby Deaver retractor. The other name of this instrument is small Deaver retractor. The category is that it is a retracting and exposing type of instrument. Now, identifying points. A flat, narrow stainless steel strip that resembles a question mark. Use. It is used for the retraction of the anterior vaginal wall and is also used for the pediatric animal procedures. End of the. Let's talk about bulb syringe. This is a picture showing bulb syringe. The other name of this instrument is baby sucker or ear syringe. It is a suctioning and aspirating type of instrument. Identifying points. A disposable, pliable, hollow bulb that extends to a soft, pliable tube. Use. It is used for the aspiration of the mucus and fluid from the mouth and nose of a neonate. This instrument should be readily made available upon birth of a neonate. And let's talk about cord clamp. This is a picture showing cord clamp. Now, the category of this instrument is clamping and occluding. A plastic disposable clamp with horizontal serrations running the length of the jaws is seen in this instrument. Use. The cord clamp is used to clamp the cord of the neonate. The cord remains attached to the newborn following separation from the placenta. The cord clamp is a single-use device and should not be closed before use because this can damage its readability. End of the. Let's talk about dilly suction. This is a picture showing dilly suction. The other name of this instrument is mucus trap. It is a suctioning and aspirating type of instrument. Now, identifying points. An oral or mechanical suction device with a 20 ml canister that has a mucus trap and filter. This prevents the mucus or fluid from entering the baby's mouth. And on the canister lid is a 10F flexible suction catheter and a suction tube. Use. It is used for aspiration of the mucus and fluid from the mouth, nose and throat of a neonate during a cesarean delivery. And this should be immediately available upon delivery of the fetal head. Now, precaution. Do not hook the suction device to a regulator on full suction because this will be too strong. End of the topic. Let's talk about Graves' vaginal speculum. Now, this is a picture showing Graves' vaginal speculum. The other name of this instrument is duckbill speculum or bivalve speculum. It is a retracting and exposing type of instrument. The self-returning retractor with inner upper and lower concave blades that are held open by a knot and screw mechanism is the identifying point of this instrument. It is used for the retraction of the anterior and posterior vaginal walls. This speculum is available in different sizes and the size to be used is determined by the size of the patient. End of the topic. Let's talk about hysteroscope. This is a picture showing hysteroscope. Now, category. It is a viewing type of instrument. Now, identifying points. The hysteroscope consists of a telescope lens, outer sheath and an inner sheath. The outer sheath is a hollow metal tube with a stopcock on the side for the inflow of the irrigation at the proximal end and a rounded angle tip at the distal end. The inner sheath is a smaller hollow tube that at the proximal end accepts the telescope lens. It also has a stopcock on the side for the inflow of the irrigation and a working channel on the other side in which instruments are inserted. The working channel is fitted with a reducer cap to prevent fluid from leaking out during the insertion and removal of the instruments. Use. The hysteroscope is a sheath and telescope that is inserted into the uterus via the vagina and cervix to visualize the internal structures of the uterus and the tubal orifices, endocervical canal, cervix and vagina. Hysteroscopy can be performed for diagnostic or therapeutic indications. Now, the stopcock should be closed before irrigation is opened. If the handle of the stopcock is aligned with the port, the stopcock is open. If the handle is up or down, the stopcock is closed. The port on the working channel should have a reducer cap and the stopcock closed to control the leakage of irrigation. End of the topic. Let's talk about Hank dilators. This is a picture showing different Hank dilators. Other names: uterine dilators or cervical dilators. It is a probing and dilating type of instrument. Now, identifying points. The double-ended probe with an elevated cuff designed to limit uterine penetration. Heaney dilators are sized from 9 to 10 F to 19 to 20 F with one end of the dilator larger than the other. Use. It is used for progressive dilatation of the cervical OS for intrauterine procedures such as DNC, suction and curettage, dilatation and evacuation or hysteroscopy. Arrange the dilators in a line from smallest to largest on the back table. Place the middle of the dilator in the surgeon's hand like a pencil with the smaller end facing the field. End of the topic. Let's talk about Heaney Ballentine Hysterectomy Forceps. This is a picture showing Heaney Ballentine Hysterectomy Forceps. The other name of this instrument are Heaney clamp or Masterson clamp. The category is clamping and occluding. A heavy metal clamp with vertical serrations running the length of the jaws and with a single or double tooth on the inner jaws can have either straight or curved jaws. Use. This instrument is used for clamping vessels and ligaments during a hysterectomy. The tooth or teeth are not sharp but provide greater gripping capabilities. End of the topic. Let's talk about Heaney hysterectomy forceps. This is a picture showing Heaney hysterectomy forceps. The another name of this instrument is Hyster clamps. It falls under clamping and occluding category. A heavy clamp with horizontal serrations running the length of the jaws and with a single tooth on the inner jaws is seen in this instrument. Use. It is used for clamping vessels and uterine ligaments during a hysterectomy. Instrument insight. The tooth or teeth are not sharp but provide greater gripping capabilities. End of the topic. Let's talk about Heaney needle holder. This is a picture showing Heaney needle holder. Now, the other name of this instrument are curved needle holder, Heaney needle driver and curved needle driver. It is a suturing and stapling type of instrument. A curved heavy needle holder with a carbide crosshatch pattern of the serration on the inner jaw is the identifying point of this instrument. Now use. It is used for the proper placement of a suture needle when suturing around curved structures and in confined spaces such as during a vaginal hysterectomy. The needle should be positioned on the jaws of the needle holder with its curve toward the swept end of the suture. End of the topic. Let's talk about Heaney retractor. This is a picture showing Heaney retractor. Now other names: lateral retractor or right angle retractor. The retracting and exposing is the type of instrument. Now identifying points. It is a 90-degree angle flat blade that extends to a curved hook on the handle end. Use. It is used for retraction of the anterior vaginal wall. The retractor is placed in the palm of the hand with the hook up and over the top of the hand for easier holding. End of the topic. Let's talk about Hegar Dilators. This is a picture showing Hegar Dilators. Now, the other name of this instrument are uterine dilators or cervical dilators. It is a probing and dilating type of instrument. Now, identifying points. It is a double-ended heavy probe which ranges in size from 1 to 2 mm to 7 to 18 mm, with one end of the dilator larger than the other. Now use. It is used for progressive dilatation of the cervical OS for intrauterine procedures such as DNC, SNC, D&E or hysteroscopy. Arrange the dilators in a line from smallest to largest on the back table. Place the middle of the dilator in the surgeon's hand like a pencil with the smaller end facing the field. This is the method to use the instrument. End of the topic. Let's talk about Kevorkian Younge endocervical curette. Now, this is a picture showing Kevorkian Younge endocervical curette. The other name of this instrument is Kevorkian curette endocervical curette, and box curette. The category of this instrument is it is a cutting and dissecting instrument. A grip handle that extends to a narrow and sharp rectangular tip is the identifying feature of this instrument. Use. It is used for obtaining cervical scrapings or biopsies. End of the topic. Let's talk about Bozeman uterine dressing forceps. This is a picture showing Bozeman uterine dressing forceps. Now, the other name of this instrument is dressing forceps or packing forceps. It is a grasping and holding type of instrument. Identifying points. Long curved forceps with horizontal serrations running 1/4 of the way down the inner jaws. Use. It is used for placing vaginal packing in the vagina after vaginal procedures. End of the topic. Let's talk about Pratt uterine dilators. This is a picture showing Pratt uterine dilators. Now, the other name of this instrument are uterine dilators, cervical dilators. It is a probing and dilating type of instrument. The double-ended probe that graduates up by 2F from 13 to 15F to 41 to 43F with one end of the dilator larger than the other. Use. It is used for progressive dilatation of the cervical OS for intrauterine procedures such as DNC, SNC or hysteroscopy. Now, the method to use this instrument is that the dilators will be arranged in a line from smallest to largest on the back table. Place the middle of the dilator in the surgeon's hand like a pencil with the smaller end facing the field. End of the topic. Let's talk about Schroeder Vulsellum. This is a picture showing Schroeder Vulsellum. Now, other name is double tooth tenaculum. It is a grasping and holding type of instrument. Now, identifying points. Curved or straight forceps with smooth round jaws that bifurcate into two sharp cupped prongs. Use. It is used for grasping the anterior lip of the cervix for manipulation. The sharp prongs on each jaw penetrate the fibrous tissue for greater control, and it is commonly used during vaginal procedures such as DNC or vaginal hysterectomy. Because of the penetration of the tissue after removal of the forceps, the sites will be accessed for bleeding. Hemostasis can be achieved with silver nitrate sticks, cautery or Monsell solution. The care will be taken when handling this instrument because the sharp prongs can easily puncture gloves and or skin. End of the topic. Let's talk about Sims uterine curette. This is a picture showing Sims uterine curette. The other name of this instrument is sharp curette. It is used for cutting and dissecting. A hollow grip handle that extends to the malleable shaft and a sharp looped tip is the identifying feature of this type of instrument. Use. It is used for scraping the endocervical and endometrial lining of the uterus during a dilation and curettage procedure. The shaft is malleable so that the surgeon can bend it to the angle needed to scrape the uterus. End of the topic. Let's talk about Sims uterine sound. This is a picture showing Sims uterine sound. The other name of this instrument may be sound or depth gauge. It is a probing and dilating type of instrument. Now, identifying points. A long narrow probe that is malleable and is calibrated in inches or centimeters. Use. This instrument is inserted into the cervical OS to measure the depth of the uterus from the cervix to the back of the uterus or the fundus. The purpose for measuring the uterus is to prevent perforation of the uterus while curating of the endometrial lining during a DNC. End of the topic. Let's talk about Thomas uterine curette. This is a picture showing Thomas uterine curette. The other name of this instrument is blunt curette. This is used for cutting and dissecting. A hollow grip handle that extends to a malleable shaft and a blunt looped tip is seen in this instrument. Use. It is used for bluntly removing the uterine contents after short sharp curetting. End of the topic. Let's talk about hysteroscope grasping forceps. This is a picture showing hysteroscope grasping forceps. The other name of this instrument is graspers. It is a grasping and holding type of instrument. Now, identifying points. These graspers have right-angled finger rings at the proximal end that lead to a long flexible wire that turns into rounded tip forceps with multiple interlocking teeth on the distal end. These are very small and will fit through the working channel on the hysteroscope. Now, use. It is used for grasping tissues in the internal uterus when excising or taking biopsies through the hysteroscope. These are delicate and should be handled with care. The wire portions should not be kinked and heavy items should never be placed on the top of them. End of the topic.